for school-age children, do they get seriously ill when infected by COVID, to the point of, is there a death, or what is the threshold that we've seen so far?
All right, so when we're talking about acute COVID, right? So certainly while most COVID in children is going to be relatively benign, there are definitely kids who suffer from severe infection. So, and those are predominantly going to be kids who have an elevated BMI or who are obese. It's also kids who have asthma, chronic lung disease, those who are immunosuppressed, certainly, and it also disproportionately affects Black and brown children. And about 1 in 100 of children who are infected with COVID will end up in the hospital. And approximately 1 in 10,000 will lose their life, unfortunately. So while it is rare, it definitely does happen. And not only that, there are also post-acute sequelae of COVID, or what we call PASC. And that includes 2 different syndromes. One is called MIS-C, or multi-inflammatory syndrome, which presents with multiple days of fever and inflammation within more than one organ, which is also rare, but a very serious complication. So 1 to 2 out of 100 of those children will lose their life, and 76% of these children end up in the ICU. So while it's rare, it is definitely a serious complication. So certainly if you have a child who has recently had COVID, and also remember that this can also happen in kids who never knew that they had COVID, that this needs to be ruled out. So if your child has had multiple days of fever, keep that in mind and call your pediatrician. And the other post-acute sequelae of COVID is called long haul, which we know happens in adults, and we now know it also happens in children. And it's early, so we're still learning about that. And there's many studies that have had anywhere from 2% to 20 to 30% of children who suffer from this. But certainly something to watch out for if kids are complaining of chronic headaches, fatigue, exercise intolerance. You definitely want to call your pediatrician and get worked up, and you may need a specialty referral depending on the symptoms.